White House Press Secretary Caroline Leavitt pointed to as proof when asked about the fraud that Elon Musk's team claims to have uncovered.
This is a DEI contract, $36,000 for U.S. Citizenship and Immigration Services. This is a $3.4 million contract, a Council for Inclusive Innovation at the U.S. Patent and Trademark Office. Oh, I love this one, $57,000 for climate change in Sri Lanka.
When pressed if those are simply things that don't align with President Trump's policies, Leavitt said,
I would argue that all of these things are fraudulent, they are wasteful, and they are an abuse of the American taxpayer's dollar.
Last night, DOJ posted on its website what it called a wall of receipts to show its findings to date. So far, it has identified roughly $14 billion worth of federal program cuts, including at least 140 DEI contracts and grants. But all the money allocated was approved by Congress, and DOJ did not provide evidence of a single case of fraud or even alleged fraud.
President Trump and the White House keep conflating fraud, waste, and abuse. Does the distinction matter?
It does matter, and frankly, both sides are using terminology that's inaccurate and confusing the public.
Dave Walker led the Government Accountability Office for a decade, the congressional nonpartisan watchdog that investigates how taxpayer dollars are spent.
Most of the things that have been identified so far by DOJ represent waste and mismanagement. Although waste is in the eye of the beholder, very few things that they're talking about have risen to the level of being fraud. Fraud is illegal. On the other side, people who oppose DOJ are also using language that's inappropriate, saying that what they're doing is illegal or unconstitutional without providing any support for that.
Last week, President Trump cited a GAO report which found the U.S. government could lose between $233 and $521 billion a year to fraud. But that data was collected from 2018 to 2022, when fraudulent COVID payments soared.
How long does it take to find fraud? Can you find billions and billions of dollars in 1 month?
It would be difficult to find billions and billions of dollars in 1 month because you have to make a legal determination, which ultimately the courts decide. You can assert that something is fraud, but that doesn't mean that it is. It's ultimately a legal judgment.
CBS News has repeatedly asked the White House for examples of the fraud it claims DOJ has found. Officials referred us back to DOJ's website and social media accounts, and they did not make anyone available for an interview.
So we
Hello, everybody. Welcome to Economics with the Honorable David M. Walker. My name is Nick Pellavita. I'll be your host for today's presentation. And today we're actually going to look at Medicare. I know that we saw a clip on him discussing fraud, which is a big problem, but Medicare may be a bigger problem in the United States because Medicare Trust Fund may be running out of money. But somebody who knows more about this, we're going to bring on right now, which is the Honorable David M. Walker, the former Comptroller General of the United States, head of GAO, and maybe can shed some light on Medicare because people are worried about the Medicare Trust Fund running out of money and Medicare running out of money with, the aging population we have in the United States. I'm not sure if that 1.45% on wages alone can cover all the healthcare cost in the USA. But David, you probably have some ideas on this.
Well, Nick, it's good to be with you. Yeah, that CBS piece was done earlier this year when DOJ was in the headlines virtually every day. DOJ evidently still exists, but you don't hear anything about them very much since Elon Musk left them at the end of May, but we'll see where things go from here. With regard to Medicare, it's important to understand that Medicare actually has 3 programs. You have Medicare Part A, which is hospital insurance. That's the program that's funded with the payroll tax, 1.45% for the individual, 1.45% for the employer. If you're a self-employed employer, you pay both sides. There used to be a cap on how much that tax applied to with regard to wages. That cap was eliminated, so it applies to every dollar of wages. Such is not the case with Social Security. The Medicare Part A trust fund, based on the latest data, is set to become exhausted in about 8 years. When it becomes exhausted, there's about a 10 to 15% gap between estimated expenditures and revenue. You can only use revenue in the trust fund in order to pay benefit payments. A lot of those benefit payments get paid directly to the providers, obviously, rather than to the individuals. And so they're going to have to figure out how they're going to deal with that. But there are two other programs for Medicare. There's the SMI program, which is the Part B program, which Part B is supplemental medical insurance, which includes for outpatient physician services and related matters, whereas hospital insurance obviously is inpatient. And then you have Part D, which is prescription drugs. That's a separate program. With regard to overall Medicare, there's also something called Part C, which is Medicare Advantage, which is an option that people can select where they in effect bundle A, B, and D, and be able to get this through a provider. Part C, Medicare Advantage, was supposed to save the government money, but it's not saving the government money, which is one of the issues that has to be looked at in reforming Medicare. So we can talk about Medicare, but I think it's also important to recognize that Medicare is a subset of the overall healthcare programs provided by the federal government. To the extent that I end up dealing with the public and others on these issues, many times what I'll do is I'll talk about Medicare and Medicaid. You also have the Affordable Care Act, which was a major expansion of healthcare that was done under the Obama administration. Some people call it Obamacare, but it's the Affordable Care Act. And so happy to engage in a discussion with you and others about Medicare and in particular and healthcare overall.
Yeah, David, the problem I have with it, that 2.9% unlimited, is the workaround is frankly too easy for the taxpayer. And I'll just give you a simple example that all CPAs and tax attorneys do for a client. Let's imagine, David, you're making $800,000 in consulting this year, okay? And that's a pretty good amount of money. You'd pay 2.9% on the entire $800,000. Instead, what happens, we set up an S corporation for you. The S corp makes the $800,000. We pay you an $80,000 salary, not $800,000, and distribute the rest as interest and dividends, and you completely avoid the 2.9% tax. So that is being done all over the United States for decades. So the unlimited 2.9% is basically a joke, at least for the high income taxpayers. Why isn't Congress addressing it? It's not a loophole. It's just the way the laws are structured. Why isn't Congress addressing what I call a very simple workaround for the high income individuals?
Well, you're touching on a bigger issue, and that is wealthy people typically make their money based upon wages, right? The situation that you just talked about is not illegal; it's legal, okay? But it does result in a significant loss of revenue, and I think that you and I both know that ultimately we're going to have to engage in very fundamental and comprehensive fiscal reform that's going to involve not just the healthcare programs but also the tax system, and we're going to have to end up making sure that, among other things, more people pay income taxes and the wealthy pay more. We're also going to have to look at the relationship of the payroll tax system to the broader tax system. I mean, for example, one of the top two tax preferences in the Internal Revenue Code is the fact that individuals don't pay payroll tax or income tax on employer provided and paid health care, whether it's active employee health care or whether it's retiree health care. That's hundreds of billions of dollars a year in lost revenues. And the last time I checked, healthcare benefits were called employee benefits, and employee benefits were called compensation.
Yeah, and the thing is, if they don't fix the tax code, what happens is that you're wasting your time on trying to increase the marginal rates because the actual rate or effective rate is like zero. Yeah, so you could have Medicare be at 5%, 10%, 15%. It really wouldn't matter as long as you can do a workaround using an S corp. And I don't see anybody in Congress even addressing this issue. And I think part of the reason why is they all use it and all their clients use it. And hence, it's kind of a conflict of interest for them to even suggest being able to cut off end runs by high income people not to pay any Medicare and or even Social Security taxes. So we have a serious problem here. I'm not sure how it's addressed internationally, but we do have an international panel. So we're going to bring in Sasha Starr from Canada, and perhaps they have a little bit different system when it comes to healthcare, and also Sharif, who's in Bangladesh and Asia, which represents about 35% of all the population. China and India do. In other words, all the population is over there, not over here, but people don't recognize it. So I'll start with Sasha in Canada, because I know that our relationships are really great with the Canadians right now. Sasha, what is the Canadian healthcare situation over there? Is your trust fund solvent, or
don't have a trust fund?
The healthcare system in Canada is run by provinces, not by federal government. And the provinces, they have quite identical plan. For example, I live in Ontario, Canada, and it calls OHIP. It's an Ontario Health Insurance Plan. And that doesn't cost you anything, even one penny. It allows you unlimited visits to doctors, hospital care, just appointments with a specialist. Okay, somebody can say that this appointment, sometimes you have to wait longer than if you would have been in the United States. It all depends. Some of it is true. Some of it you can speed it up. Let's see, if it's an MRI procedure and you agree to do it 11 in the evening, you may get it in actually a few days' time. But if you want to do it normal daytime, then you wait 5 weeks, 7 weeks, whatever it might be. So it's a nature of the situation, because obviously demand on MRI equipment and people who run it much more during the normal daytime hours than during the night hours. Okay, that's something what you have to have in mind. All these systems, I'm talking about provincial healthcare systems, are run quite efficiently. I never heard about any threats of running out of money or anything like this. About 20 years ago, there was a uprising in Ontario of doctors who operate under OHIP system, that they believed that they are underpaid, and instead of being real doctors, as it's in a Western understanding of this word, they're becoming social government employees in a way. And there was a big upheaval, and I know personally a couple of doctors who were on strike, and eventually it was settled, and it ran pretty well the same way as before the strike. So it's just, I don't know what was the agreement reached, but it continued to run well over 20 years since that strike, quite smoothly, in my opinion. Now, talking about relationship with Canada, it's not Canada, it's relationship with the rest of industrial world. That includes Canada, that includes European Union, that includes Japan, South Korea, and many other countries. when Trump, after the Liberation Day, went on to suggest 90 days extension, so there is 90 countries approximately, so it will be a deal a day, and all this tariff issue will be done and over with. Well, to my knowledge, in 90 days, he reached only one deal. It's 10% tariffs with United Kingdom. That's it. So he now extends deadline to August 1st. European Union deal is 25%. Oh, I think yesterday he said, no, it's going to be 15% and I'm ready to negotiate. He's ready. That's nice. Is European Union ready? No, European Union is not ready. It doesn't need any deals with the United States. So is Canada, so is Japan and South Korea. The only reason to do any deal with the United States is that United States could send B-2 bombers like it did with Iran. The problem is that there are just too many countries and he just doesn't have so many bombers. He has about 19 B-2 bombers. That's not enough. He needs to send, like Iran, he sent 16 bombers. So one Iran, 16 bombers. So there are so many countries now, 90 countries he has to send, 90 times 16. He doesn't have the bombers available. So where's he going from here? Nowhere. He has to get on his knees and quickly. Thanks.
Well, let me clarify a couple of things. First, the tariff situation is about economics. It's not about military capabilities. It has nothing to do with that at all. To set the record straight, we didn't use 16 bombers for Iran. We used two bombers to hit Iran. Look, I have a problem with how Trump is approaching the tariff issue. On the so-called Liberation Day, he said that he wanted to have reciprocity with regard to tariffs. And yet when he announced what his proposed tariffs were, they were basically a mathematical calculation as to what the tariff would have to be in order to close the gap on the trade deficit between these various countries. That's not reciprocity. We need to get this situation resolved sooner rather than later. I think the most important countries for us to resolve it with are Canada, Mexico, Japan, the European Union, China, and South Korea. I think those are by far the most important. What Trump is trying to do is he's trying to use it as leverage because we have the biggest market in the world. I mean, our consumer market is very attractive for everybody. My personal view is that we should promote free and fair trade, and the only time that we should ever impose sanctions or tariffs would be if there's an unlevel playing field, and they would be targeted and they would be temporary. There's one big footnote to that, and that is one of the things the United States has to do is the United States has to become self-sufficient with regard to has to become self-sufficient between ourselves and our allies, and of which obviously Canada is one of our allies, okay? But there are many other allies. We have to become self-sufficient with regard to critical national security and public health needs. We are not self-sufficient with regard to that right now. We are unduly reliant on China in particular for rare earth materials and certain other matters that are necessary for example, making prescription drugs. And so I think, I share Sasha's concern and frustration over the current state of tariff negotiations. And that's one of the reasons that the Federal Reserve has hesitated to lower their interest rate, because they don't know what the longer term implication of these tariffs are going to be. And the administration complained about the fact that, when the estimates were done on the cost of the One Big Beautiful Bill Act, they didn't consider tariffs. Well, how do you consider tariffs when you don't know what they're going to be? But what I will tell you is the days that the United States can fund a significant part of the federal government with tariffs are long over. And even though we were collecting a lot more tariffs this year than we did last year, the gaps are so great, you're not going to solve your problem with tariffs. And in addition to that, you could create additional international relations problems, which Sasha has talked about before, between ourselves and some of our allies, if this thing doesn't get resolved in a reasonably timely and equitable manner.
Okay, we're going to go to Asia now, and Sharif Rana to listen to what he has to say about the healthcare system over in Asia. It represents 35% of the population of the world, and if you add a couple more countries, it's basically 50%. So, what do they do over in Bangladesh and Asia, Sharif?
Okay, thank you for this opportunity. I just want to share a breaking news. It's very bad news for Dhaka. There is a tragic military jet crash into the school in Uttara. I live in Dhaka, so Uttara is not far from my place. I live in Dhaka, Dhanmondi. So a Bangladeshi Air Force F-7 BGI training jet crash into the Milestone School and College campus in Uttara. And shortly after taking off around 1 p.m., and the pilot reportedly attempted to steer the jet away from the densely population area before it struck the school. So for that particular issues, 19 people died, including the captain of this aircraft. 171 injured. So that is very bad information for Dhaka. So I urge through this program, definitely the Dhaka city mayors and all of the policymakers, we need to develop a better urban planning. So when you discuss about these healthcare issues, uh, honestly speaking, Bangladesh is not good shape in healthcare issues. Not only Bangladesh, in the COVID-19 situations, we observe Asian many countries, they cannot successfully solve these COVID issues properly because of lack of investment in healthcare issues. Uh, Especially my World Talent Economic Forum, we are working with the grassroots level communities. Actually, Bangladesh, around 50% people live in the grassroots levels. So we are going for urban planning and all of the things. Definitely, we have lack of finance, lack of resources, lack of expertise, but we are helping these communities. Look, today around 171 school students, though those who are around 11 to 16 years old, they die, they burn in the schools. How uh, tragic situations we have it right now. Besides that, I just want to share as Honorable David Walker in these situations, this 35%, 5% reciprocal tariff starting in August 2025 for Bangladesh, it actually create a massive problem with our garments industries. Bangladesh, all of the people, let's say we have to go for our taking care of our healthcare, our children, our everything. So many people, they have heavily dependency in the garments industries. So Bangladesh is at risk. Over 85% of Bangladeshi garments industries, they export their product in US around $10 billion. They export in year 2023 and 2024. So I request how we can negotiate this problem. Yes, for you, China, Japan, South Korea, European Union, all of the countries, even Canada is very important. But country like small countries like Bangladesh, we have heavily dependency on U.S. economy in terms of economics, in terms of our activities. So I think how we can strategically solve these things, how we can negotiate with U.S. government, possibly can play a major role. Honorable David Walker, Nick Palveda, you are very experienced. You can help our these things. For these particular issues, I know around 500,000 people. They will heavily affected for their job loss and economic issues for these tariff issues and healthcare issues. I just want to say we have lack of doctors, lack of expertise, a lack of nurse, and all of the things. The global leaders, the global communities, we are heavily need to focus on how we can improve this area. We need more subsidy, we need more help, we need to strengthen this UN or this ecosystem, NGO ecosystem to support this emerging economy. I urge to everyone, please work effectively with the emerging economy, not only for business, but with your humanity and all of the things. Thank you.
If I can I jump in?
Yes, of course.
First, Sharif, condolences with regard to the loss of life and all those that were injured with regard to this tragic event that happened evidently today. It hasn't made news yet in the States, but I'm sure it will at some point. Secondly, you're right that there are a lot of countries like Bangladesh, especially to the extent that you're talking about textiles, the garment industry, if you will. I mean, we can't compete with Bangladesh or many other countries with regard to textiles, and yet we're a big market for you, and so therefore, while it's not a big part of our trade in the aggregate, it's a big part of yours, and that's something that has to be recognized, that we need to try to get through these situations in a more timely and equitable manner. From the big picture, talking about healthcare, let's just recognize a few things, and then I'll let others talk and then come back to potential solutions. The United States spends almost 20% of its entire economy on healthcare, which is by far number one in the world. Nobody's even close. And yet at the same point in time, we have below average outcomes in a number of key areas as compared to other major industrialized nations. We have a below average life expectancy. We have above average infant mortality. We have above average medical error rates. And I could go on, part of which is because we have a very fragmented system. Most people who are employed get health care through their employer. If you're part of a union, you may get it through a union plan, which is jointly managed by both management and labor union leaders. If you work for the government, you get it from your governmental employer. Okay. If you are a senior citizen, you typically get it through Medicare. If 65 and over, that's health care for people 65 and over. Some employers offer retiree health care benefits for retirees who have worked for them for a number of years, but fewer and fewer are doing that, so more and more relying on Medicare. If you are poor, and we can debate what poor should be defined as, but if you're poor, based upon the current definition, you get it through Medicaid. If you're a veteran, you get it through the Veterans, Administration. And so we have a very fragmented system. We also pay for activities rather than outcomes. And so therefore, the more you do, the more you get paid. We also have a problem with regard to our malpractice system. You have a lot of situations where physicians are not only, and other providers are not only encouraged to do more and to prescribe more because they get paid more, but because they believe that will reduce the chances that they will end up getting sued, for failure to do something or prescribe something or provide something that otherwise could have been done. We have, I think the largest type of advertising dollars that are spent in the United States now, it used to be cars, but now I think it's prescription drugs. And so we have advertising for prescription drugs on television, radio, et cetera, which just drives demand, which is not something you want to do. And I've already mentioned our tax system, how, normally when you provide tax incentives, you're trying to encourage something. But in our case, we're encouraging excess consumption, which is obviously not appropriate, affordable, or sustainable over time. So just wanted to mention a little bit of the lay of the land, lots of administrative cost. I'll give you one example, and then Mark will come to you. At some point in time, Nick, I want to go back to what the people think possible solutions could be in the healthcare area. One example, I had a terrible automobile accident, December 14th, 2024. The bills for that the healthcare bills for that auto accident still have not been resolved. and it's a bloated bureaucracy that's trying to deal with it. 2 insurance companies are involved, 1 provider's involved. And I've spent a considerable amount of time trying to get these things resolved in an equitable manner. But another example of this is that the healthcare provider, who will not be mentioned, sent a bill for $35,000 when I was had no surgery, was in the hospital for a little over a day, and but it doesn't pass a straight face test. But trying to get this thing resolved and people to get paid an equitable amount of money in a reasonably timely manner has proven to be extremely difficult. So I'll leave it at that. And then, Mark, did you add something?
Yeah, I did have a couple of questions, and I know it's something that I bring up sometimes. I know Jacoby brings it up as well. But how can we get past the both the race and the class issue within the healthcare costs and all along those lines? So because as you just said, I've been fortunate enough to have family members that have had some severe health situations. Fortunately, they are of the middle class variety and everything. My brother's significant other had a new heart, and she is still paying for some of that new heart that she had probably about 1.5 years, 2 years ago. And my dad, as I've said on this show before, had some serious health issues that dealt with his heart and everything along those lines. And of course, there's an age gap difference of the my brother's fiance is like in her, I want to say around 50s or something like that. And of course, dad's in his 80s. But even when you look at the healthcare crisis, it's a known fact. It's been a fact for a while that women, particularly African American women, are having a serious gap and are definitely, they say, 2 to 3 times more likely than other parts of our society to have pregnancy-related illnesses and all along those lines. So those are just some examples that are both in my personal life and then the statistic that I just gave and everything. So how can we get past this issue of the class and the race differential that goes on in our healthcare system, which adds to some of this inequality that we're talking about?
Well, first, as you know, the number one cause of bankruptcy for individuals in the United States is healthcare costs, right? And part of your question goes to what the public felt might be a more reasoned and reasonable way to try to approach healthcare on a going forward basis. Right now, we provide the greatest healthcare to senior citizens. Some of us are on this call, and yet when you look at income, and the lowest poverty rate in the United States is senior citizens. The highest poverty rate in the United States is children, who represent our future. Okay, one of the things that I posited in my travels around the country for citizen education engagement is, what are some of the things that we need to think about doing that would be a much more fundamental change to try to provide essential health care and to better control costs, and to also deal with some of the real or perceived inequity issues. And here's one at the top, and then we can come back and talk about more. And that is, the federal government should be in the business of providing universal, and yes, I use the word universal, health care for basic and essential services that would be delivered through, private sector, providers, whether they be for profit or not for profit, with the exception of the Veterans Administration, although the veterans should have an option to go to private sector if they can't get timely service through the VA, which has been a problem. Now, how do you define basic and essential health care? The general view among the public was that means preventative, wellness, and catastrophic protection. In other words, the preventative wellness are things that can help keep us healthy, that can help turn us into a healthcare system rather than a sick care system, that can end up improving our life in general, that can reduce the chance that we're going to have major illnesses, if you will, or other activities. But catastrophic is protection against financial ruin due to an unexpected accident or illness. So the idea was that you have a single risk pool, publicly financed for that, delivered through private not-for-profit sector, and then employers, unions, industry associations, um, uh, you know, states and other groups can end up having additional offers for healthcare that goes above and beyond that to fill in the gap, if you will. The government's always going to do more for the poor. The government's always going to do more for veterans. But the problem is, which happens in government all too frequently, they overpromise and underdeliver. And they subsidize too many, and they write blank checks for too much. So the main point that I wanted to make is to rethink where we want to be in the future. You'd have to transition to this, okay? Where we want to be in the future with regard to universal health care. There are a number of other elements that they supported as well. But I think that goes, and you can tell me, Mark, whether or not that goes to some of your concerns.
That goes to some of the questions and some of the concerns. Just really quickly, what do you guess the average cost is of an average citizen for healthcare? Because even if I use my brother's significant other, I'm guessing that she, like I said, has a new heart and has a daughter who is diabetic. So I'm guessing that probably I would guess probably 15 to 20% of that, might even be more than that, goes towards some of their health costs and all along those lines and everything like along those lines. I was just wondering, what do you guess is the percentage that people are spending on healthcare, if you have any ideas?
Well, I'm not typical because as I said, I'm under Medicare, right? And Medicare premiums are income related. Last time I checked, I think between my wife and myself, I think we're paying about $14,000 a year in insurance premiums. Obviously, there are circumstances in which you have to end up paying a deductible or copay on top of that. But just for the basic insurance, I think it's like $14,000 a year for the two of them.
That sounds about right and everything like that. Just really quickly, and I'll get off this topic and everything. I know that a dear friend of mine was a heart attack survivor, and all along those lines, a multiple stroke survivor, and he also takes care of his aging mother. So I know a lot of times when I talk to that good friend of mine, he is going to the local pharmacy to get the drugs either for himself or for his mom or some of the other people that they take care of. So I know that their costs are probably significantly high as well. I don't know the percentage, but I imagine it's probably
but that's why I say catastrophic, because catastrophic varies based upon the individual, right? I mean, what is catastrophic for me is not the same as some of the people you're talking about. That it would be their catastrophic would be a much lower number than it would be for me. And so I think one of the things the country needs to do, which it doesn't do well, is you must separate between wants, needs, affordability, and sustainability. Healthcare is probably the biggest area where we have to reconcile those differences, as compared to the status quo. Nick, you're muted, buddy. Nick, you're muted.
Yeah, I'm unmuted. Okay, David, I have a question. The healthcare is a very important topic, as we well know. 20% of our GDP. Are there hearings going on right now in Congress to, fix the Medicare problem and fix our healthcare?
You just went mute again. But the answer to your question is, not to my knowledge, and they're about ready to go out for over a month for their summer break.
Okay, so what you're saying is that a part of our economy, which is 20% of our GDP, one of the most important issues in every American in the United States, a system that's going belly up in less than a decade, Congress is doing what currently?
Not enough, if anything.
Not enough of anything. Okay, so why do we vote for these people? I mean, the thing is, there's nobody who's doing anything. I'll yield the rest of my time to Jacoby, but I kind of rest my case at this point in time. Jacoby.
I mean, the getting into the voting and why they voted, that becomes a whole political topic that'll get us off discussion. But my question is, because Dave, what you described earlier in terms of your fix for healthcare, wasn't that the public option, the transition piece that they wanted to do when they first came up with the ACA? And then it got demonized and they went on the whole idea of what was it, death panels and all the other things
Yeah, let's talk about
to
that.
kill it.
Yeah, let's talk about that. Okay. First, the big difference, Jacoby, was they weren't talking about basic and essential health care. They were talking about much more comprehensive coverage than that. So that was the big difference. Okay. As I said, what the government tends to do is when you define the terms basic and essential, they define it very expansively to the point where it's not affordable and it's not sustainable over time. And what I try to do when I deal with the public is I try to actually ask them, which, believe it or not, their elected officials typically don't do and don't want to do because they think they have all the answers and they just try to do the sell job on their constituents to the extent that they interact with them. And now more and more, they're not holding town hall meetings. They don't really want to hear what the people have to say, which is terrible. Okay, but my approach is different. Look, healthcare is of critical importance from a number of different angles, but we don't have unlimited resources, and we need to decide how we're going to prioritize, how we're going to allocate the resources that we have. So again, to try to engage the public in what's the difference between wants, needs, affordability, and sustainability. There was broad-based agreement that preventative, wellness, and catastrophic, everybody needs, no matter what your race, your income, your age, your ethnicity, everybody needs that. Okay. Beyond that, there are wants and in some cases needs. Okay, for the poor, it's a need. Okay, it's a want maybe for middle class or upper middle class. We need to address that in a different manner because government has not proven to be very effective at delivering on its promises and on achieving economy, efficiency, and effectiveness.
And I think that's where the negotiation comes into play, because I think killing the idea isn't helpful. Because as you point out, we agree on. I mean, we can call it public option, we can call it whatever, but the question becomes, what do we define as basic needs? What do we define as these necessities? So I think the problem comes into play. I think that that pinpointed and that point in time showed everything, all the problems that we have with healthcare. As we tried to transition during that time and do as we asked and do this whole, we could negotiate over that public option and push forward and move to that transition piece and get even moving towards a universal healthcare, which would have put us in a better position today than we would have, now. But we ran into politics, demonization, and putting out misinformation to win elections rather than to fix a system that we know is broken. And that can point out the problems that we have across all portions of government, as an example. But again, sticking with the healthcare, it just boiled down to that negotiation piece, but we couldn't do that negotiation piece because we had to win an election.
Well, unfortunately, Jacoby, that's the way it is on a lot of issues. Okay.
Yeah.
I hate to say it. We now have a republic that is not representative of nor responsive to the general public. We have too many of the Republicans that are doing whatever Donald Trump wants. We have too many Democrats that don't want to do anything that Donald Trump wants. They're both wrong. The sensible center, which I would argue is where 60% of the public is, center right, center left, are largely unrepresented. A vast majority of Republicans are far to the right of center. A vast majority of Democrats are far to the left of center. They don't want to compromise. Every election is about control. Control makes all the difference in the world. So we have a problem. But let me set the record straight. While the media has really placed emphasis on the strike that involved two B-2 bombers, that there were 7 that were used. Sasha, I want to correct the record there. 7 were used in all, given the number of bunker buster bombs that were used. But the fact is, the United States is the only country in the world that could have done that. We can debate on whether it was right or wrong, but it's the only country in the world that could have done it.
Hey, David, just really quickly, I don't know if you saw Kim's comment and everything like that, but she was giving us this idea of blockchain and all along those lines, and I was wondering your thoughts around that and everything like that. But just in addition to that, I like your idea of these conversations. And a couple of weeks ago when I was doing a festival, there's a group here in Durham called Braver Angels and everything. And that's literally what they're trying to do. They're trying to get people to actually have conversations across the divide. So like Democrats and Republicans, Libertarians, and everybody to actually talk to each other and not at each other and everything like that. So they were actually one of the vendors there, and I thought that was a great idea. I think they're Virginia based, if I remember correctly, but they are definitely here in this area as well. But they are, I think, some ex-military people.
Well, I'd have to give some additional thought to this blockchain idea, and I have to know a little bit more about it before I can make an intelligent comment on it. Blockchain is obviously a relatively new invention that's used in a number of different ways, including with regard to cryptocurrency. But I need to know more about it. But again, I come back. I do believe there is some level of universal health care that is needed, and I believe that we need to consider that. We need to consider evidence-based payments. Not just paying for activities, but it's based on evidence. Some of you may know that I was one of 2 co-chairs of the Institute of Medicine's End of Life Committee. I get all the easy things to deal with, right? Like, how do we put our finances in order? How do we deal with end of life issues? In evidence-based decisions are particularly important there. You want to do what you can to improve or extend life, but you don't want to be throwing things at situations where you can't meaningfully improve or extend life. We need to limit the healthcare tax exclusion. We need malpractice reform to provide a safe harbor for physicians who are trying to do the right thing, but don't want to just necessarily do everything because it's wasteful. We can't write a blank check for healthcare. We can't write a blank check for healthcare. We need to modify the subsidies. Those that are better off should pay more than potentially they're paying right now. We need to reform Medicaid, potentially go to a block grant system with minimum federal standards, which says you have to provide this level of coverage, no ifs, ands, or buts. We'll share on the cost of that with the states. But if the states want to do more than that, they can do it, but they have to pick up the extra cost. We should ban advertising for prescription drugs. We should expand negotiation, the ability to negotiate for drug prices more than we have right now. It's been expanded a little bit since my book came out, but not nearly enough. And we need to do more with regard to home health care options to be able to provide more services in your home rather than having to go into an institutional setting where, frankly, it costs a lot more money to go in an institutional setting than it does to provide some of these things at home. And most people want to be home.
Hey, David,
can we get science actually back? That's another thing, because, for example, right now, if the big push, the dyes and the inks and stuff like that coming out, I mean, we're putting out false information as if other countries aren't putting in the same chemicals in their actual food or the food additives, and we're lying about that and pulling out things that have helped. Also, like for example, not that have helped, but yes, putting in natural sugar rather than that sugar additive. Yeah, that's a good thing, but it's not really a great thing, which they're trying to make it out to be as a solution. It's like getting a Diet Coke and still getting a Big Mac. You're not really doing anything with that. So taking out the sugar or changing the sugar in a high sugar drink with a high sugar meal is not going to do anything for anybody.
Well,
It's just so we're putting out that false information and not actually doing any preventative measures based around actual science now. So that I think could help.
Yeah. Well, first, I think science is obviously very important. Okay. It's my understanding that a lot of our foods in the United States contain dyes and other things that are not allowed. Okay, I don't know all the details. Okay, let me finish. That are not allowed in other countries, especially in the EU. Okay, and we ought to understand why. I mean, what's the difference, and why is there a difference? What's the impact? The other thing I would say is many people call sugar the white tobacco. All right. And in this country, we have way too many people with diabetes. We have way too many people that are overweight. And one of the things that contributes to that is sugar and so-called junk foods. Okay. And so I think part of when I talk about wellness, I'm talking holistically. It involves, trying to provide more public education of what you should and what you shouldn't do. And as we've all heard the saying, moderation, right? I mean, it's not that you can't have things that are sugary. It's not that you can't, have, a Big Mac or whatever you want to call it or whatever else. But, things need to be done in moderation, or else you're going to have some serious health problems. And if you have serious health problems, they could have serious adverse consequences with regard to your lifespan and your quality of life.
I think that is what we should do, but that's not what we're actually doing.
I hear you.
And in terms of like the dyes and the different things, because I was curious about it myself, and there's actually some great information out there. But like a lot of that stuff that we're saying is illegal here, it's just called something different in the EU. So if it's called something different and people run with the idea that, oh, you can't find it here because it's illegal, it's not. It's just labeled something different.
Yeah. Well, my view is, Jacoby, I'm a substance over form guy. Okay. I don't care what you call it. I want to know what it is. Okay. and I'm all for science. Okay. As long as it's real science. Because we've also had people in the past claim that certain things were based on science that I'm not so sure.
I mean, that's what we have now with RFK and that whole group, because they are not doing any kind of science. They are actually, for example, with vaccines, all the pulling of the vaccines and the breakout of measles and
I'm not so sure that Fauci was all science either, but I hear what
Fauci had been there for Fauci's whole career.
I know what Fauci's career is. I know about it. And I also know he got a pardon too. So,
but he got a pardon because Donald Trump is going in trying to get vengeance on people. That was a difference. Okay. Also, but Fauci's career was inside.
Right?
RFK's career.
That's a whole nother show and everything.
Let's get on to something else. Okay.
Yeah.
You got the medical. I did have a quick question for you, David, and everything, because you mentioned getting rid of the advertisement of medicine and things like that. And I'm with you on that and everything, because I know I was just recently watching my local TV and saw an ad for everything from colon guard to diet supplements and all along those lines.
Restless leg syndrome. I'm still trying to figure out what the hell that is.
Yeah, so would you get rid of those advertisements too and everything?
Hell yeah, they're gone.
They're gone. So like the supplement, the claim they can have you lose weight in like 5 days or 10 days or whatever and everything like that because it's some sort of liquid magic.
The problem is the media won't want that to happen because they make a hell of a lot of money on these ads.
Speaking about a group that makes a lot of money, what about the insurance companies? From the industry that I work in, they represent about 25% of the additional cost, insurance and administration. Should insurance companies be involved in our healthcare?
They don't need to be involved with regard to the basic and essential. Okay. I think whether or not they're involved in the supplemental, like the gap, you got to fill in the gap, I think is up to the sponsor of the program. I think it's up to the employers, it's up to the unions, it's up to the industry associations, professional associations, whatever, as to how they want to accomplish that objective. In many cases, as you know, Nick, insurance companies will be involved because they're providing administrative services only. In other words, they're just processing the claims, and they may be providing some stop loss insurance, if you will, but beyond that, they're just doing administrative services. So, I think it's facts and circumstances.
Everybody's so quiet. I think we're waiting for the Ozempic commercial.
Well, my brother just told me yesterday when I talked to him on the phone. I have two brothers. I'm the oldest of the three, but I'm probably in the best health. I don't know, but he just told me he's taking some drug, and I'm not going to say what it is, but it's not the one that you just mentioned. And that he's lost 17 pounds, in the last, couple of weeks or whatever else. And, but he also said that he's changed his diet and he's getting more exercise and, all right, that's good. There is no free lunch though.
The interesting thing for me is that I found out that, knowing that Ozempic comes from Gila monster saliva, that's just wild. Who decided that, hey, I'm going to try this to cure this? It's just
you watch the commercials and everything. There's also that Rise commercial now as well. So apparently, all you got to do is drink this special mushroom tea that's going to make you just have all this lovely stuff as well.
Much BS out. There's so much BS out there. It's just unbelievable. Yeah.
And the funny, so I guess what's interesting is how this goes back. I guess kind of ties into misinformation that gets put out there. For example, anybody can come on and say, hey, look, if I grind up this rubber ball, put it into some milk, and then spin it around and drink it, I will lose. I could go on TV and make up all that stuff, get people to donate and give me all this money, and I really won't. I can walk away with all that money. I mean, Dr. Oz did. So you can actually make up whatever you want to on the internet now. This gets into the misinformation, and how do we regulate that? How do we take care of that notion, which causes a lot of problems within the healthcare industry as well, for fixing these ideas that these random placebo pills that people create, that people take and then end up sick?
Yeah, there's all kinds of stuff out there. I mean, although they do have to say it's not FDA approved or whatever else, and they don't have to say caveat emptor, but most people wouldn't even know what that means. But anyway, all right, Nick, we're getting there, buddy.
Okay, yeah. So the thing is, it looks like we've solved the healthcare problem. We noticed that Congress isn't going to do anything, so they're doing what they typically do, which is nothing. I am shocked that they're not even holding hearings on the Medicare Trust Fund right now, because 8 years from now isn't that far, David.
No,
and
it's not.
What are we going to be discussing? The healthcare crisis next? Is that going to be it? And that we don't have money to pay for Medicare? But it looks like the system is sick all the way down. But we do want to thank our special guests from around the world, Sasha Starr from Canada and Sharif from Bangladesh, and the former Comptroller General of the United States, the Honorable David M. Walker, on an interesting conversation about Medicare. We'll see you next week on Economics with the Honorable David M. Walker. Take care.
Take care.